Hi, Dr. Steve Crealese with Club Chiropractic. Today I'm going to talk about antagonistic muscle groups in the human body. And this is an important topic. A lot of patients end up with cramps and muscle spasms. And one of the best things you can do is, if you know about antagonistic muscle groups, you can maybe do some things at home to try to relieve that problem. So just to explain a little bit, a good example of an antagonistic muscle group would be your biceps muscle on the front of your arm, which bends the elbow, and your triceps muscle on the back of your arm, which straightens your muscle when it contracts. So the nerves that go to those two muscles are different, because if they weren't, if the same nerve went to them, when that nerve fired and told those muscles to contract, both would contract, and they would fight against each other, and your arm wouldn't move. So the way we're wired neurologically, these antagonistic muscle groups have different nerve pathways that go to them, so that when you exercise one half of an antagonistic pair, the other half, behind the scenes, without you having to think about it, is being told to relax and lengthen and let the other one work. So if I'm exercising my biceps at the gym and doing a curl, my nervous system is telling my triceps to relax and lengthen and not be so tight. So this comes into play if you end up with a spasm or a cramp in a particular muscle. You can use this information to your advantage. So what you would do, let's say you get a cramp in the back of your thigh. That's your hamstring muscle back here, and that hamstring muscle bends your knee. Well, your quadriceps muscle is its antagonistic pair, and that straightens the knee. So if you end up with a cramp in your hamstring, one of the best things you can do is just contract your quadriceps by straightening your knee as hard as you possibly can, and you'll find that this cramp in your hamstring subsides. And the reason that will happen is, again, like we talked about earlier, when you contract one half of an antagonistic pair, behind the scenes, your nervous system is telling the other half to relax and lengthen and stop being so tight. So again, a lot of people get calf cramps. The calf points the toes, basically. It flexes the ankle. And so if you get a cramp back there, you want to exercise the muscles in the front of your shin, which extend your foot upward. So if you do that as hard as you can when you've had a cramp in your calf, you'll find that the cramp in your calf will start to feel better. Another example is, a lot of people get low back spasms. And if you have low back spasms, there is a muscle group that antagonizes or opposes your low back muscles, and that is your core or your abdominal muscles. So one of the best things you can do for low back cramps, low back pain, is to exercise your core, exercise your abs, crunches, pelvic tilts, pelvic thrusts, and behind the scenes, your nervous system will be telling your low back to relax and quit being so tight. So I hope that helps. Maybe you can find a use for it in your life. And again, Dr. Crealese, Club Chiropractic.